Very good evening, friends. Meeting again in the session of Materia Medica. Little bit busy today, that's why uh, I was not able to join you immediately. Basically, we're going to learn new remedy in today's session, and I had wonderful experiences with this remedy. I will share two experiences. One case was interesting. It is in my practice, and uh, I never expected such type of thing, which a patient can narrate the history or all those things. Uh, a lady around 37 years of age, along with her husband, came to me, and they have big this much of reports along with them. And every investigation was done related with her problem, and she had very severe burning micturition, and she was diagnosed as a case of, just a minute. She was diagnosed as a case of cystitis, non-specific cystitis. That was the name given to her disorder. And there many investigations, scopy was done, then USG, a number of times USG was done, even scan was done, nothing found, only everyone was labeling it as a cystitis, and they have the drawn figures, and bladder was in all inner linings were of the bladder was swollen, and all those big reports, nothing was coming out. So I decided I asked them that today is not possible. Tomorrow I will take her case and we'll start with the treatment. Um, Her husband was a professor. He said, sir, tomorrow in the afternoon it is not possible for me to come along with. She will come alone. Is it okay? I said, it's okay. And next day in the afternoon, 2 o'clock, she came. And to start with the case, she started, doctor, you have done a good favor for me. So what is that favor? I asked, what's the favor? Doctor, I would not able to give you whole history if my husband was there with me. And you have asked me today, and he is not there, so that I will share each and everything, what the problem, how this has started, and all those things I will going to share with you. Okay, then she started narrating that she is having this problem since last 3 4 years, and it is so severe that I cannot go anywhere. Before coming to your clinic, I went to for urination at least 3 4 times in last half an hour, and I could not control. Once I get an urge, I could not control, and it's terrible pain, severe burning is there. And since last 3 4 years, I'm consuming continuously on antibiotics. Antibiotics, they were giving me that cetal liquid, and then some Ayurvedic alkalizer they were giving me, all those things, but it never works. It works for some time, but it never works. Even today, before coming over here, also I have consumed that liquid cetal and some Ayurvedic preparation, but I could not get a result from this, and I'm frustrated, really frustrated. She was very good looking, from a very noble family, and she was very interesting. So I said, it's okay, but what problem, doctor? I'm having severe urging, and then I feel that the part should be rubbed sore, and there is tremendous irritation over there. I could not control my hand. I touches over there, and I get very sexual drive at that time, and which is not getting fulfilled from my husband, and that I could not tell with him, and that is basically my problem. I don't know what I am telling is right or wrong, but and you can blame me at this age, but sir, I could not control myself. I had my old friend, once he met just 3 months back, and we had a relation. I could not control that. That is tremendous. Once I get an urge, I could not control. I'm doing masturbation, and it's terrible pain is there at that time. But at the same time, because of this, I have started getting this, and itching is so tremendous that the whole part has become sore because of it. Sh- She's told about all those things, and she said, this I could not share with anyone, but I have told you because I'm suffering tremendously. I am not getting the answer for it. I think homeopathy requires all those things. I have read about it, and that's why I have shared all those things to you. And then she explained that whenever she get an urge, there she has to pass urine at the same moment. She has to go to the toilet. She has to pass urine, and she said that it drops. It continuously passed by drops, and every time whenever it is coming out, it is too painful, and there is tremendous burning. So that was very important problem. Then she said, sometimes I'm even at night during sleep, I get an urge and tremendous, then I could not control. There is tremendous spasm over there, and it is as good as that. At that time I feel I must die. This is so severe. I'm tolerating it last 2, 3 years, but nothing was getting a result for me. So, so severe burning is the characteristic of Cantharis. That's what I was doing. Second important thing, these qualities, increased sexuality, is another quality which can go with the animal remedy. So that was second thing. Third important quality which was there is the nymphomania, tremendous excessive sexual desire in females specifically. Having this irritation over there is again is there with the one remedy. You can think of Platina, but she was not the lady of superiority complex with the Platina has. In fact, she was not dominating her husband regarding that. That is not her nature. She doesn't want to lose her, and that's why she was in problem. So nymphomania is another important feature which is there in this Cantharis. And fourth important that she said, she told me that it passes drop by drop, and sometimes it blood also passes through it. That was fourth important thing which was associated with it. Cantharis is having very specific action on genitourinary area in case of females as well as males, but in females it is more strongly present with this. So I considered to give her Cantharis. I've started with Cantharis 30. Cantharis bears the repetition. So I have started with Cantharis 30 and I have repeated Cantharis 30. I asked her to take for 2 days at least 4 to 5 times, and then you make it for 3 times, and then you start taking it 2 times and meet me after a week. She started with Cantharis 30, and literally within a 48 hours, she called me, Doctor, wonder has happened. Your work remedy is working so nicely. I'm feeling relaxed. In last 3 years, first time I'm feeling relaxed. I don't have a burning. I don't have a urging. I'm passing very clear urine. She was too happy within 2 days. I said, let us wait for some time. She said, okay. And she continued with the remedy. I asked her to take it only twice if it has started working, and asked her to meet me after a week. And she came, and she said she was happy when her husband came along with her, and both of them are happy. And they said that not we have stopped taking the antibiotics, stopped taking that alkalizer and that Ayurvedic medicine. Everything we have stopped, and still your remedy is working, and it has worked so beautifully that her problem, she used to wait at night for 4 5 times during whole night. That has also stopped, and everything is wonderfully worked. So this remedy is a very good remedy for cystitis, chronic cystitis, non-specific cystitis, non-specific urethritis, non-specific urinary tract infection. When the burning is the characteristic, when there is a urging is characteristic, irritation is the characteristic, and in case of females, it is associated with excessive sexual hyperesthesia and nymphomania. It is also a wonderful remedy in males also. Males are also having similar types of problems. But female urethra being a small and short, UTI is very common with them. And if it is associated with all those features, Cantharis works. So Cantharis was given and it has a very good result. One result I want to tell you that was in our hospital. Uh, a patient delivered normally. Uh, she had just a episiotomy and she was a primey and she delivered with a little bit time she has taken. But during that period, she started getting burning urination. And she was complaining, I'm getting burning, burning, burning. And she delivered a baby. A good baby, was in good condition and everything was going on, but placenta was not coming out. It was 10 minutes, 15 minutes, 14, placenta was stuck. And she was complaining, doctor, I'm having burning for urination. And she was passing it drop by drop, drop by drop, drop by drop. And all of a sudden, she had an epileptic attack. She never had during the whole pregnancy, she never had. And she goes into the convulsion with retained placenta, with a burning micturition. So I was there, we are handling that case. I thought this I have read somewhere. So I searched it immediately, and there is one rubric in Cantharis, retained placenta with convulsions and spasms with, and retained placenta along with severe painful urination. These are single remedy rubrics of the Cantharis. I was knowing Cantharis is very good remedy for retained placenta. So immediately I went to OPD, I brought Cantharis. I have given Cantharis 203 doses every 15 minutes. And after putting one drop of Cantharis in her mouth, she gets relaxed. Her spasm stopped. She came out. And with 2 more doses, her burning micturition stopped. Her placenta came out very easily without any remnants over there. It is a wonderful remedy to remove the retained placenta other than cecal corn. This is one more remedy. It is a one more remedy. If dead fetus is there, in IUD, I have used this remedy to start the pens and to remove the fetus. Other than the sabina, sorry, cecal corn, no, it is sabina, sorry. Sabina, other than sabina, this is one more remedy one should think of. So it is a wonderful experience to utilize the Cantharis at clinical level over there, and it works. So this is the remedy, small remedy from the Allen's keynotes. We're going to learn the Cantharis. Allen has written it Cantharides. Original name is Cantharis vesicatoria. That is the name of the remedy. This Spanish flies, the Cantharid. Dr. Hahnemann himself has proved it, and reproving have been also done regarding this remedy. There is oversensitiveness of all parts, and this sensitivity is too marked in case of Cantharis. Hemorrhages from the nose, mouth, intestine, genitals, and urinary organs. So, hemorrhagic remedy. Third important feature, which is most marked, pain is raw, sore, burning in every part of body, internally and externally, with extreme weakness. Severe burning. That is, burning is the characteristic of this remedy. And this is a wonderful remedy in burns. Many times I have used for the burns. It is the first remedy to be utilized internally. I am not using it externally, but I am using generally in internally because it stops the burning pains over there. Disgust for everything. Disgust for drink, disgust for food, disgust for tobacco. Once patient starts getting this burning, pain or rawness, this disgust for food always develops. Drinks also develops. There is Drinking even small quantities of water increases the pain in bladder. And that is characteristic. Generally, UTI is there. We used to ask the patient to drink maximum water. And these are people who refuse it. They feel that once they have to go to the urination, and that creates a problem, that creates a burning. And that's why they, they avoids taking the fluid. Small quantity of fluid causes a trouble for them. One feature which is not written over there, but add in your Materia Medica, urine scalds and pass drop by drop. It scalds the part, it burns the parts. That is strong urine, acidic urine, acrid urine. Constant urging to urinate, passing but few drops at a time, which is mixed with blood. So this is one characteristic feature of the Cantharis, specifically in acute UTI. This is a very important feature one should not forget. There is one more remedy which has been mentioned over there. Sudden desire to urinate and intense itching in urethra, petroselenium. Yesterday also we have considered this remedy. We have considered cannabis sativa where gonococcal urethritis is there. Here it is non-specific urethritis. And third remedy where the itching is very marked and patient tosses in agony, jumping from bed to bed is petroselenium. Intolerable urging before, during, and after urination, violent pains in bladder. And these are people who used to go to bathroom every 10 minutes, 5 minutes. There is tremendous urging and they goes and runs. That is very typical with this. Burning, cutting pains in urethra during micturition, violent tenesmus and strangury. Strangury is very important. What? It is a pain with spasm. Strangury during passing the urine, even passing the stools. Both levels, the strangury is there with the Cantharis. Stools. Passage of white or pale red tough mucus, like scrapings of intestine with streaks of blood. So this is a very good remedy for dysentery, specifically bacillary dysentery. This is again one remedy where burning is the characteristic with strangury, very severe pain, like carboanimelis, like colchicum. This is one more remedy for dysentery. In colchicum, it is autumnal dysentery more common. Bloody nocturnal emissions, that is characteristic of this, ledum, the mercurius, the petroleum. These are the remedies where there is bloody nocturnal emissions are there. Sexual desire increased in both sexes. This is very specific, not only in males, not only in females, both they have. Preventing the sleep. Violent priapism with excessive pain. Picric acid, yes, priapism is characteristic in picric acid. Priapism is nothing but continuous, long continued erection of penis due to some problem at the spinal cord is the priapism. And that is the same feature which you can get in picric acid and you can get it in Cantharis. The priapism is very marked over there. Violent priapism with excessive pain. Tenacious mucus in the air passages. So Bovista, the Calibicromicum, these are two remedies. We know that their expectoration is sticky, mucoid, ropey, stringy. Compare Cantharis if the vesical symptoms correspond. So if there is a cough, expectoration is stringy, ropey, tenacious, if there is associated vesical symptoms, that is bladder symptoms, cystitis, this remedy is the first remedy to be think of. Skin it has very marked effect. Vesicular erysipelas, erysipelatous conditions. It is very typical, the erysipelatous, the redness, the uh, upper layer of the skin, cellulitis, which happens to be there with blister formation, post-burn blister formation. This is one first important remedy. Even this is a good remedy in herpes zoster where such types of burning is present. So vesicular erysipelas, vesicles all over the body which are sore and suppurating. Erythema from exposure to sun's rays. Sun's rays causing erythema. This is very important remedy. One should not forget. Very important. The sunburn. First important remedy to be think of. And if there are vesicles or erythema, this is very important remedy. One should not forget. The burning can be tackled with the help of Cantharis. The burning pain and intolerable urging to urinate is the red strand of Cantharis in all inflammatory affections. See, it is given in italics, the burning pain and intolerable urging to urinate. Finish. This sentence one should not forget. This is characteristic of Cantharis. Very important. All inflammatory affections, whatever may be the complaint, this feature is there. Few features one should add. Nymphomania, this is very important remedy. Then relationship similar to Apis, arsenic, equisetum, mercurius. You can add the remedies over there. The petroselenium, another remedy which is very close to it. Complementary remedy is camphora, which is not mentioned over there. Just write it in your book. Complementary is camphora. Antidote is coffea. Antidote to the cantharis is coffea. The action is 30 to 40 days. It is deep acting remedy. Then there is one feature which is not mentioned over here. It promotes expulsion of moles, placenta, dead fetus, foreign bodies from the uterus. This is given by Boric. It is given in many Materia Medicas. Allen has not written it over there, but it is a wonderful remedy for retained placenta. Promotes expulsion of moles, placentas, dead fetus, foreign bodies from the uterus. Then last thing which he has mentioned over there, burns before blisters form and when they have formed. So this remedy burns, and if blister is not yet formed, give the Cantharis. It prevents, and even though blisters are formed, give the Cantharis. If the skin be unbroken, apply an alcoholic solution of any potency and cover with cotton. This will promptly relieve the pain and often prevent desiccation. If skin be broken, use the boiled or distilled water, and in each case give potency internally. So you should utilize this remedy externally as well as internally for the burns. Only thing is that if it is unbroken skin is there, you can utilize alcoholic solution for applying. If it is broken skin, then boiled water instead of alcohol. If you will use the alcoholic, it burns a lot and it produces more burning. So if there are ulcers, it is better to utilize it in boiled water or distilled water. So Allen has given wonderful aspects of it. My suggestion, go through this remedy from the Borix Materia Medica, as well as go through the this remedy from the Ken Mathur's Systematic Materia Medica. It is a wonderful book. One should have it. It gives you many aspects. Ken Mathur was a MBBS fellow, and he has written a systematic Materia Medica, and really it is systematic. Whatever is written by him in the books related with each and every remedy, the details are very nicely mentioned over there. So my suggestion to go through that Ken Mathur's book if you have. So that's all regarding the keynotes. There was some question at the start.
Yes.
So,
Yes, sir.
yes, Dr.
Sir,
Mohan.
good evening, sir. Sir,
Good.
two questions. One
Hmm.
is like Cantharis, the case you told us, it's a chronic case. So after Cantharis, is it necessary to give constitutional such as pulsatilla, medorinum, or you have to just leave the case?
It, it, it itself is a chronic remedy. It is not a short acting remedy. It is a deep acting remedy. It covers the whole thing. If you feel it has been not completely covered, then it is necessary to give or utilize the another remedy at that time. Otherwise, it itself is sufficient to cure the case. In this case, I have utilized medorinum very late. She never had a recurrence. After 1 year, she started again some problem. I have used Cantharis, it worked, and then I have given the medorinum because there was a history of exposure later.
Okay. Sir, one more question.
Hmm.
It's not regarding Cantharis. I have attended your rheumatology lecture. So in that you had said Rustox tenem and Ruta tenem acts best in rheumatoid arthritis. But if the small joints are involved too much, then we think of colophyllum. But in what potency colophyllum will act?
Qualophyllum is a remedy which you can use in 200 medium potency. uh, Coliphylum, you don't have to go to the high. Coliphylum itself, proving is done with coliphylum in low potency, and it has made a good proving with the low potencies, and it works in low potencies 30-200. There is even, I have not used the coliphylum 1M. I have used 200 maximum, and you can repeat the coliphylum. Even in 30, you can repeat.
Frequency?
You 2 times, 3 times a day. Generally, I used to give twice a day.
Okay. Thank you, sir. Thank you.
Yes.
Thanks, Atan.
So complementary to Cantharis is camphora, sir.
Yes, it is given in Borix Materia Medica, Camphora. Just a minute, I will confirm, but I'm sure about it. Camphora is the complementary to the Cantharis, because I have not opened. Yes, Camphora. Camphora is complementary to the Cantharis.
So,
There are
but it's a bit confusing. Camphora is totally cold and clammy, and Cantharis is very hot and burning.
What do you mean by complementary? Complementary means a remedy which has not done complete work, previous remedy, and if whatever is remaining is expressing the symptoms of camphora, then you give the camphora. It is not always that you should give the camphora. Keep it in your mind. It is not a complete remedy relationship. No? Whatever Gibson Miller they have found, they have collected, they have worked, that has been written. It is not always that you are going to get the same remedy as a complementary. If the patient's feature are indicating like some features which are indicating medorinum can complement. It depends. It is not only this is what we are having. This is the availability what is we are having, but it doesn't mean that it is 100% only that thing is there. It can be
Okay, sir.
complemented by any remedy with which it presents at that time. There were many questions today. Very happy. Dr. Vidya, she has asked how to differentiate between Apis and Cantharis. Simple. Apis is thirstless, absolutely thirstless. Cantharis is not thirstless. Apis is absolutely hot. Apis, where there is a urine is very scanty and there is associated edema, puffiness. Cantharis, there is no puffiness, edema, which is present, which is characteristic. It is not failure state which Apis is having. Cantharis is the case of clearly a urinary tract infection or bladder infection. So you can easily differentiate. So how to differentiate sabina and Cantharis and IOD and retained placenta? How to use these medicines in such cases? My suggestion is that it depends. In sabina, you get the bleeding quality. The partly it is clotted, partly it is fluid. That is one important characteristic which is there with sabina. Sabina is the first important remedy you can think in retained placenta. But second remedy, if it is associated with UTI, burning micturition, then you are damn sure that it is Cantharis. How to differentiate is that for cystitis, how long should we use this remedy after symptoms subside? You can stop if symptoms are subside, and then you can find it out if it has been needed any complementary. Otherwise, you can stop after getting the results. So I'm happy that such types of communication is happening, and this is what the this is what I expect from you. It should be a discussion that gives many things. So thank you being there, and thanks for questions also, so that we can discuss, and because of discussion things becomes very simple. So good night, and we'll meet tomorrow again with one more remedy at night. And those who are not attending lecture, my suggestion, do attend the philosophy, because philosophy is the base behind these prescriptions. Okay. Thanks a
Yes,
lot.
sir.
Good night.
Thank you.